Hello, I'm Dr. David Russ. I'm a chiropractor. I practice in Portland, Oregon, and for the last 10 years, I've made a special study of scoliosis. If you're watching this video, you probably have a child that was recently diagnosed, or maybe you yourself were recently diagnosed with scoliosis, and you're wondering, what does this mean, and what do I do? And let me start by saying that scoliosis is extremely common. Many people have scoliosis. I have scoliosis. You do not need a perfectly symmetrical spine to be healthy. You do not need a perfectly symmetrical spine to be beautiful. You do not need a perfectly symmetrical spine to be balanced. There is no such thing as symmetry in the human body. It doesn't exist. Some bodies are less symmetrical than others. When you have scoliosis, your spine is less symmetrical. It doesn't mean that you can't be active and live a normal pain-free life. The first question a lot of people have is, what causes this? And the answer is, usually, we don't know. Sometimes there is an obvious cause, such as one leg being physically shorter than the other, causing the pelvis to tilt, and then the spine has to curve back in order to get you back in balance. Sometimes vertebrae develop asymmetrically. A normal, typical vertebra is a square. Sometimes vertebrae are a little bit triangular or wedge-shaped, which causes the spine to list in one direction, and then you get the scoliosis to get you back in balance. In those cases, the scoliosis is only there because your body knows how to achieve balance. But for about 90% of people, there is no obvious cause of scoliosis. There are a lot of theories, including birth trauma, genetics, who knows what else. What I have seen in a lot of children and teens with scoliosis is that there seems to be a lag in the development of their gross motor skill. Whether or not this is related to the cause of their scoliosis or is an effect of scoliosis, I don't know. But one of our goals is to improve the gross motor skill. One of the great tools that we have to help kids with this is the Pilates Reformer. And using the Pilates Reformer, we can help kids and teens and adults understand what neutral is for them, how to find it, how to be strong and balanced in neutral, and how to layer movement of hips and shoulders and knees and legs and arms on top of a strong neutral spine, in addition to education and training about breathing and using the breath to keep the ribs and the spine as mobile and stable as possible. Folks ask me about bracing, so I will just address that in general terms here. Sometimes bracing is necessary. Bracing is not easy and bracing is not comfortable, so it's not something that should be done lightly. I also believe very strongly that bracing should only be done in conjunction with exercise and hands-on manual therapy. Another question I get is about hands-on adjusting for kids and teens. How young? And is it safe? And yes, it is safe. I generally do not adjust anyone under the age of 5 years old. There are other providers who specialize in that. Everyone's different, but it's usually between the ages of 6 and 8 where they're ready for the kind of work that I do and the skill set that I'm comfortable applying. It looks very different in kids than it does in adults. It's much gentler, it's much easier, and they need much fewer sessions. A kid's adjustment session is 5 or 10 minutes. That includes time for them to sort of feel comfortable with what's going on, get up and down off the table if they need to. And we use manual therapy with kids for two main reasons. The two things that manual therapy is really good at are restoring mobility and decreasing pain. So when pain is a prevalent part of the kid's life, or restriction of motion is there and it's inhibiting their activities and it's inhibiting their ability to engage in the kind of rehabilitative exercise we want them to, that's when we use hands-on therapy. The last question that I get very often is about surgery. And when is spinal surgery and when are Harrington rods and when is fusion appropriate? And the answer is very rarely. So the conditions that generally are agreed upon in order to justify surgery. Number one, there needs to be a severe curve that is causing pain and restriction of movement, seriously, significantly impacting the person's ability to engage in activities. Another very strong criteria is that the curve has created enough crowding of the heart and lungs that it's interfering with cardiovascular function. If those things are not happening, I do not recommend surgery. Our goals with treating kids with scoliosis is not to reverse the curve. You cannot adjust out a scoliotic curve and it's dangerous to try. Our goal is to do everything we can to slow the progression and stop it where it is. Our goal is to keep the child out of pain and fully functional so that they can do everything else that they want to do and minimize the impact of the scoliosis in their day-to-day life. And our long-term goal is to teach how to manage this themselves so that they have a sustainable self-care plan, a way that they can keep themselves stable, mobile, healthy, and balanced for the long term through their adult life. I do not want to have lifelong patients. I want them to be self-sufficient. I want them to go away to college and not see me and not need me. We are here for those early stages when education is necessary and when we need to teach them how to get strong and stay strong and improve their gross motor skills and coordination. I really hope this video has helped you. I welcome your questions in the comments. All my contact details will be in the video description, and you are more than welcome to reach out to me via email, text, or phone. There's lots of ways for us to help, even if you're not here in the area of Portland, Oregon. So again, I thank you for watching, and I hope this has been helpful. I'm Dr. David Russ.